day, everyone. So for today's discussion, we're going to talk about joints. So here's our objectives. At the end of the lesson, the class should be able to learn the three structural classification of joints, define the different types of body movements, and identify the joints that allow for these motions. Also, students will gain an understanding of how exercise benefits the joints. These are the following subtopics. Classification of joints: fibrous joints, cartilaginous joints, synovial joints, types of body movements, and the last one is exercise helps joints. We all know that joints are the areas where two or more bones meet to allow movement depending on the type of joints. Such separated elements may or may not move on one another. There are three structural classification of joints: fibrous joints, cartilaginous joints, and synovial joints. Fibrous joints are connected by dense connective tissue consisting mainly of collagen, and where adjacent bones are strongly united by fibrous connective tissue. There are three types of fibrous joints. These are suture, syndesmosis, and gymphosis. So first is suture. Suture is the narrow fibrous joints found between most bones of the skull. So yung mga lines sa skull, this is what we call the suture joints. Next is syndesmosis joints. The bones are more widely separated but are held together by a narrow band of fibrous connective tissue called a ligament or a wide sheet of connective tissue. This type of fibrous joints is found between the shaft region of the long bones in the forearm and in the leg. Lastly, a gymphosis is the narrow fibrous joint between the roots of a tooth and the bony socket in the jaw into which the tooth fits. Next is cartilaginous joints, are a type of joints where the bones are entirely joined by cartilage, either hyaline cartilage or fibrocartilage. These joints generally allow more movement than fibrous joints, but less movement than synovial joints. Sa fibrous joints kasi is limited yung movement, while the cartilaginous joints is a little bit movement. Then the synovial joints, it moves freely. So yun yung pagkakaiba ng tatlo. So there are two types of cartilaginous joints. These are synchondrosis and symphysis. First is synchondrosis. It is an immovable cartilaginous joints. So, when we say immovable, it is incapable of being moved or not moving. One example is the joint between the first pair of ribs and the sternum. The sternum is a partially T-shaped vertical bone that forms the interior portion of the chest wall centrally. As we can see in the picture, yung naka-highlight na color blue is dyan nagko-connect yung sternum at yung ribs, which we call synchondrosis. Second is the symphysis, which consists of a compressible fibrocartilaginous pad that connects two bones. This type of joints allows for some movement. The hip bones connected by the pubic symphysis and the vertebrae connected by the intervertebral disc are two examples of symphysis. So, let's proceed to synovial. So, we're done with fibrous joint and cartilaginous joint. Synovial naman. Synovial, it is also now known as diarthrosis. Allow the most movement. Yun yung sinabi ko kanina. It moves freely. A synovial joint is the type of joint found between bones that move against each other, such as the joints of the limbs. For example, shoulder, hip, hip, elbow, and knee. Meaning, it allows individual to achieve a wide range of movements. Synovial joints achieve movement at the point of contact of the articulating bones. Allow bones to slide past each other. This produces movements called abduction, adduction, extension, flexion, and rotation. Later, we will discuss about that. For now, we will talk about the 6 types of synovial joints. Some are relatively immobile but more stable than mobile joints. Others have multiple degrees of freedom but at the expense of greater risk of injury. The 6 types of joints include gliding joints, hinge joints, pivot joints, condyloid joints, saddle joints, and the last one is ball and socket joints. So, first is gliding joints. Gliding joints, also known as plane joints, only allow sliding movement. It moves against each other on a single plane. Major gliding joints include the intervertebral joints and the bones of the wrist and ankles. So, makikita natin sa picture. Then, second one is hinge joints. Allow flexion and extension in one plane. It moves on just one axis. These joints allow for flexion and extension. Major hinge joints include the elbow, and the finger joints. The third one is pivot joints. Allow bone rotation about another bone. A pivot joint provides rotation at the top of the spine. The atlas and axis form a pivot joint that allows for rotation of the head. Fourth, condyloid joints perform flexion, extension, abduction, adduction movements. It allows for circular motion, flexion, and extension. The wrist joints between the radius and the carpal bones is an example of a condyloid joints. By the way, just look at the picture para malaman nyo where does the different joints located, okay? Then, let's proceed to saddle joints. Permit the same movement as condyloid joints and compound joints. A saddle joint allows for flexion, extension, and other movements, but no rotation. In the other hand, the thumb saddle joint lets the thumb cross over the palm, making it opposable. Then the last one, the ball and socket joints allow all movements except gliding. The ball and socket joint is a freely moving joint that can rotate on any axis. The hip and shoulder joints are example of ball and socket joint. So, we are done with classification of joints. So now let's proceed to the types of body movements. So we have a lot to discuss here. First, flexion and extension. Flexion decreases the angle between two structures as they bend or move closer together, while extension increases the angle between two structures as they straighten or move farther apart. For example, elbow or forearm flexion. The angle between forearm and arm decreases as ulna moves towards humerus bone. And then, the elbow or forearm extension, angle between forearm and arm increases as ulna moves away from humerus bone. So, makikita natin dyan ang demo. Next is shoulder flexion. Shoulder flexion, angle at the humerus of arm and scapula bone decreases as arms move anteriorly. And while the shoulder extension, angle at the humerus of arm and scapula bone increases as arms move posteriorly. So just look at our presentation for you to, para may guide kayo. And then, let's proceed to spine flexion. Spine flexion. Angle between spine and hip decreases. And then the spine extension, angle between spine and hip increases. Spine can continue to extend beyond the anatomical position. Then, let's proceed to abduction and adduction. So, anong pinagkaibahan ng abduction and adduction? Abduction is the movement of a structure away from its midline reference point, while the adduction occurs as the structure is added back toward the midline reference point. In short, these are the two terms that are used to describe movement towards or away from the midline of the body. For example, abduction of arms, moving away from the midline, while the adduction of arms, add arms back towards the midline. Next, another one is wrist abduction, moves away from midline. And then the wrist adduction adds wrist towards the midline. Next is circumduction. Circumduction, an angular movement that blends the motions of flexion, abduction, extension, and adduction to create a circular or conical motion. Next, let's proceed. Let's go on to rotation. Rotation. So, it is a body movement term that describes a bone moving around the central axis. The rotation occurs in head, vertebral column, upper and lower limbs. Upper is yung hand natin and lower limb is yung leg natin. Of course, the head, we can actually rotate it like this, like sa presentation na pinapakita. Next is vertebral column. It is also called spinal column. Spinal column. Spine or backbone, which can rotate laterally to the left or right. And then the upper and lower limbs. For anatomies, the upper limb consists, ito yung sinasabi ko, the upper limb consists of the arm or the upper arm, the forearm or the lower arm, and the hand will be the lower limb consists of the thigh or the upper leg, and the lower leg and the foot. So, proceed naman tayo sa special movements. We have also the special movements. Special movements, we have, first is supination and pronation. Supination, rotation of radius in lateral direction or moving in a sideways direction, leaving thumbs pointing away and palms up or forward. Ganito, palms up forward. And then, while the pronation, lateral rotation of forearm, leaving palms forward and thumbs away. Ganito. And then, let's go to dorsiflexion and plantar flexion. The dorsal is the back or the upper side of the foot, while the plantar is the sole of the foot. So, tingnan nyo lang yung sa presentation para makita nyo kung paano siya gawin. If you do that, it is what we call dorsiflexion, yung nasa PPT. Then, if you move your foot, like that, this is plantar flexion. Plantar flexion helps you stand on your toes and walk in any direction. Then let's proceed to inversion and eversion. So inversion, the soul turns away from body's midline. Yung body's midline natin is ito, body's midline. So simply, when we say inversion, it is inwardly. while the eversion, it is evert, which is turn outward. Okay, next is depression and elevation. Depression refers to movement of a body part in an inferior direction or moving downward. Elevation. Well, elevation refers to movement of a body part in a superior direction or moving upward. So, elevation and depression commonly refer to movement of the mandible. Ang mandible, ito yung largest bone in the human skull which hold the lower teeth. The picture shows the depression of the mandible. As I said well ago, it is moving downward. So, you must move your lower jaw downward, while the elevation of the mandible is the moving upward. Simply, you're going to close your mouth. That's it. So, another is same as the shoulders. If we perform elevation, kailangan mong itaas yung both shoulders mo. And for the depression, dun mo na ibababa ang balikat mo or ibabalik sa normal position. So, elevation, ganito siya, moving upward. And then, ang depression is moving downward. Ganun lang kasimple. Next, we have protraction and retraction. Dito naman, opposite sila. During protraction, the scapulae or the shoulder bone move away from the spine as you round the upper back. In retraction, the scapulae move towards the spine and towards each other. It is done by squeezing the shoulder blades together. So, tignan nyo lang yung sa presentation para may guide kayo. Ayan. So, let's proceed to excursion. I think last part na to, excursion. Excursion, but before that, what is the difference between medial and lateral? The medial is towards the body's midline, while the lateral is away from the body's midline. As we can see in the picture, it is lateral excursion. It moves in a right or left direction. It depends on you if you move it in right or left, basta away from the body's midline. And then the medial excursion, the mandible moves in a right or left direction towards the body's midline. So, babalik siya sa normal position. So, kung dito ka, babalik ka sa normal position mo. And the last one is opposition and reposition. Opposite action pa rin siya. Ganun. Opposite of the thumb occurs when the tip of the thumb comes to meet the tip of another finger from the same hand. In fact, think about this. When the opposition movement occurs, pag ginagawa natin yung opposition, anong nangyayari? Ganito siya. Meet the other finger. Ganito. Ganyan. Ganyan. So, anong nangyayari? As we can see in the picture, did you notice how the thumb and finger created a shape na similar sa letter O? Ganito, di ba? Similar sa letter O, which stands for opposition. Through this, we can easily remember this motion, di ba? So, ganito, O, opposition. Ganyan. On the other hand, during reposition naman tayo. During reposition, babalik sa original position yung thumb and finger. Ganun lang. Diba? Ganito, opposition. And then, babalik siya sa normal position, which is the reposition. So, now we are done with classification of joints, yung fibrous joints, cartilaginous joints, and synovial joints, types of body movements, and then let's go on to exercise helps joints. So, how exercise helps your joints? Movement is essential for maintaining joint health. Use of joints naturally increases flexibility and strength. But motion also lubricates joints and reduces swelling. Not only will exercise help maintain joint health in the long term, but it will also help reduce joint pain symptoms almost immediately due to production of natural painkillers called endorphins. Flexibility and range of motions are key to joints health. You may not realize it, but staying in motion helps keep your tendons and ligaments strong. So we have so for me, physical activity has many benefits for the body. People choose to exercise to keep fit and to look good, di ba? Along with the visible positive impacts, exercise also improves your body in areas that you cannot see. For example, in your joints, di ba? There are several types of exercise na makaka-benefit sa joint natin. From low-impact aerobics to muscle-strengthening exercise such as yoga and resistance training. High-impact activity in particular helps to build and maintain joint strength. However, most kinds of physical activity will benefit your joints in some way. So the question is, why do joints need exercise? Joints are the physical connections between bones surrounded by ligaments and tendons that join bone to bone and bone to muscle. There are many types of joints in the body that give you the ability to move, such as synovial joints, ball and socket joints, and pivot joints. Like most elements of your body, your joints can benefit greatly from exercise. Movement helps to lubricate joints, ultimately reduce swelling or pain in damaged joints, and improve conditions such as arthritis. There are many ways to keep your joints healthy, including a nutritious diet, nutritional supplements, and preventive medicine. But the foremost method is regular exercise. So we have some benefits here. First is improving flexibility, of course. Flexibility and range of motion are keys to joint health. You may not realize it, but staying in motion helps keep your tendons and ligaments strong, both of which are essential for mobility. Strengthening your muscles and joint tissue will help you retrain joint function, but will also help protect you from additional injury in the future, which could determine your joint health. Light strengthening activity can improve your flexibility and keep your joints lubricated. Kagaya ng low-impact stretching activities, it can strengthen the muscles around your joints, providing some much needed pain relief for damaged joints. The beauty of yoga kasi is that you can adapt the poses to your needs, so that the more you practice this spiritual sport, the more you can push yourself and improve your level of flexibility over time. Second is softening up your connective tissues. Exercising regularly helps to your ligaments, enhancing your joint health by allowing them to reach a full range of mobility without damaging themselves or overextending. Ligaments and tendons are tough connective tissues that act as the glue that holds your body together. Yung ligament is siya yung nag-a-attach sa bones to bones, while tendons attach muscle to bone. Both muscle strengthening aerobic exercise can help to strengthen these tissues, and the more they are stimulated, the less likely you are to have a joint-related injury. So, exercising regularly helps to your ligaments, enhancing your joint health by allowing them to reach a full of mobility without damaging themselves or overextending. Sinabi ko kanina. Then, third is balance your weight to stable joints. Seemingly, simple acts like walking, standing, or sitting actually require complex coordination of many muscles and sense organs. Having a good sense of balance improves your overall movement, while stabilizing your your core and increasing mental focus, makaka-benefit din yung joints mo as it is easier for you na makagalaw without experiencing pain, and accidents are less likely to occur, and also it can improve your ability para makontrol mo yung movement and coordination mo. The last one is weight loss. If you have joint problems and then overweight ka, consider participating in a regular exercise to help you lose those extra pounds. Pwede kang mag-try ng mga light physical activities like walking or swimming. This can improve your range of motion and flexibility, and once na mag-lose ka ng weight, magagawa mo ng mag-bend and stretch more easily with less strain on your joints. So, yung mga nabanggit ko is mga ilan sa mga benefits ng exercise to your how exercise helps your joints. Yun lang po.
My name is Rovelyn Araneta, and the topic that has been given to me is sports injuries and rehabilitation. So good afternoon, everyone. So our objectives is to know what are the kinds of sports injuries, and the second one is to discuss what is the importance of sports rehabilitation. So what is sports injuries? Sports injuries are injuries that occur when engaging in sports or exercises. Sports injuries can occur due to overtraining, lack of conditioning, and improper form or technique. So in short, ang sobrang pagtitraining, kailangan natin mag-train upang tayo ay gumaling. Pero ito po ay nakakasama sa ating kalusugan and also to our muscles. And then lack of conditioning. Pag hindi po kondisyon ang ating katawan at tayo po ay sumabak na sa isang kompetisyon sa ating sports, ay maaari po tayong magka-injury. So the first type of sports injury is pulled muscle. Muscle strain is another name for pulled muscles. It occurs when a muscle is overstretched and tears. Symptoms of pulled muscle may include pain, swelling, weakness, and difficult or inability to use muscle. We have three types of pulled muscles. First one is the pull. If 5% po ng ating muscle ay na-disgrasya po, kailangan lang po nating magpahinga, take some rest, and then magiging okay na rin po siya if 5% ng ating muscle. Second one is the sprain. Commonly, makikita po natin to sa mga basketball players. And then, nangyayari po ang sprains commonly sa mga basketball players, and it limits the use of your muscles for over a 1 month. So, over a 1 month po bago gumaling ang ating sprain. And the last one is the worst, the rupture or full rupture. It means that your muscle is already broken and it needs surgery para gumaling ang muscle. So, ang kailangan po natin gawin upang maiwasan po ang ganitong pangyayari or para maiwasan ang pulled muscles, and its three types, kailangan po natin mag-exercise, stay flexible to keep your body safe from pulled muscle, and then you need to stretch your body. The second example of sports injury is the torn ACL or the anterior cruciate ligament. Helps hold the knee joint together and provides stability. A torn ACL is a sports injury that may occur when landing the wrong way, changing direction, or stopping quickly, or from a direct blow to the knee. And the example of the sports that may cause torn ACL is the basketball, soccer, and etc. People who suffer a torn ACL may hear a pop and then feel their knee no longer function. They will feel pain, swelling, and loss of range of motion are symptoms of torn ACL. It may be difficult to walk. A torn ACL needs to be reconstructed surgically. The surgery called arthroscopic procedure using a graft from another ligament in the patient's own body. So, pag na-break po ang ating ACL, so meron pong gagawin na surgery. Kailangan po ng surgery para gumaling. So, ano ang gagawin pag naputol po ang ating ACL? As what I have watched in YouTube, kuha po siya ng maliit na parte sa ating patellar tendon para gawing pamalit aling ACL. And the operation will last in 1 to 2 hours. Significant rehabilitation is necessary to restore the strength and function of the knee joint after surgery. Pero, depending on the age, health status, and desired activity level of the patient. Nakadepende pa rin po sa patient. Some may not elect to have a surgery. Meron po kasi mga tao na pipiliing hindi magpa-opera. In that case, braces and physical therapy will not cure the condition, pero they will provide some relief. The third one is the Thorn MCL, or the medial collateral ligament. Connects the upper part of the leg bone, or tinatawag na femur, to the larger bone of the lower leg na tinatawag na tibia. It is located on the inner side of the knee, sa ating tuhod. The MCL is typically injured when the knee joint is pushed sideways when making a wrong move or by receiving a direct blow to the knee. Ang example po ng mga sports na pwede pong mag-cause ng Thorn MCL is skiing, soccer, football, basketball, and the last one is tennis. Ang Thorn MCL po ay nagre-resulta ng pananakit, pamamaga, and instability of the joint. The condition is often treated with ice. Pwede po siya pagalingin ng ice, bracing, and physical therapy. Pero kung ang other structure sa ating tuhod ay na-injure, or if the Thorn MCL is severe or malala, surgery may be recommended. Kinakailangan na po siyang operahan. The next one is Shin Splints. Symptoms are throbbing, aching, or stabbing pain on the inside of the lower leg. Shin splints are a repetitive use injury that may occur in runners. Usually, sa mga runners po ito nangyayari. Or those who are beginning to exercise. Nagsisimula pa lang tayo mag-exercise. Ang pain ay nangyayari when muscles and tendons around tibia or the larger of the two lower leg bones become inflamed. Stretching, resting, and applying ice can help relieve shin splint. Non-steroidal anti-inflammatory drug or NSAIDs can reduce pain and swelling. Bandaging the area may help preventing swelling. Flat feet increase the risk of shin splints. Orthotics and proper athlete shoes, kinakailangan po natin ng proper athlete shoes, may offer support and decrease the risk of shin splint. If flat feet lang po, magdi-decrease po ang risk of shin splints. So, to avoid shin splints, we need to use athletic shoes. The next one is stress fracture. A stress fracture is an overuse injury that occurs when muscles are no longer able to absorb the impact from physical activity and the bone absorb the pressure resulting in a break. For example, is the overtraining. Stress fractures can occur when increasing activity, especially too quickly. The majority of stress fractures occur in the lower legs and feet. Women are more prone to stress fractures than men. Women are more prone to stress fractures than men. Why? Studies have shown that women are greater at risk of developing stress fractures than men because for this increased risk include hormonal differences, increased bone density, and a higher rates of inadequate nutrition. So, stress fractures causes pain with activity. For example, basketball, gymnastics, and track and field. Rest is prescribed to allow a stress fracture to heal. Kailangan nyo lang pong ipapahinga ang iyong paa para ito po ay gumaling. Sometimes, a special shoes or a brace can help decrease the stress of the bone, which facilitates healing. Hindi po siya kailangan operahan. Kailangan lang po nating ipagpahinga kasi po na-overtrain lang po tayo. So the next one is sprained ankle, most common. A sprained ankle occurs when the ligaments that support the joint become overstretched. Ankle sprains may occur while playing sports or doing everyday activities or even walking. Stepping wrong on an uneven surface or stepping in a way that twists and rolls the foot may lead to an ankle sprain. Sprains and the pain that they cause may range from mild to severe. So, you can treat sprained ankles through rest, ice, compression, and elevation. Also, non-steroidal anti-inflammatory drugs or NSAIDs can elevate pain and swelling. Severe sprains may require a brace or cast for several weeks to facilitate healing. So the next one is tennis elbow. Tennis elbow is an overuse injury that may be associated with playing racket sports. Plumbers, painters, and those in a similar profession are also at risk. Tennis elbows involves inflammation of the tendons on the outside of the elbows caused by small tears. Tennis elbow causes pain and may be associated with a weak grip. Rest and non-steroidal anti-inflammatory medications can help alleviate tennis elbow symptoms. Wearing a special brace on the forearm may help decrease pressure on the sore area. Physical therapy may be helpful. Steroid injection can decrease inflammation. Surgery may be an option for the tennis elbows when other treatments have failed. The next one is low back pain. There are many causes of low back pain. Back pain may be due to overuse, such as playing too many rounds of golf and lifting heavy weights. This kind of back strain usually revolves on its own without treatment. Rest and anti-inflammatory medication can provide relief. Using proper form when exercising and increasing the duration of workout slowly can help protect the back. In some cases, it may be necessary to modify exercise techniques or perform daily activities in a different way in order to reduce the risk of back injury. Other causes of back pain may be more serious and require medical and/or surgical intervention. The next one is the hip bursitis. The hip region contains two major bursae. The one located on the outside of the hip is called the trochanteric bursa. The other is called the ischial bursa, which covers the ischial tuberosity, more commonly known as the sit bones. Inflammation of either bursae may lead to stiffness and pain around the hip joint, not to be confused with the true joint pain of arthritis. Overuse from running, cycling, and similar activities can lead to hip bursitis. The condition causes hip pain that tends to be worst at night. Getting up from the seated position may cause pain. Treatment of hip bursitis consists of avoiding activities that produce symptoms and taking non-steroidal anti-inflammatory drugs or NSAIDs to reduce pain and swelling. Physical therapy and steroids injection may be warranted. Using a cane or other assistive device may help take the load off the inflamed joint. The next one is concussion. A concussion is a traumatic brain injury or TBI that occurs when the brain undergoes rapid acceleration inside the skull. A a direct hit to head or body may cause a concussion. People who engage in contact sports like football are increased the risk of concussion. The symptoms often include headache, loss of consciousness, memory loss, sleepiness, nausea, vomiting, and more. A thorough neurological exam is necessary after a concussion to determine the extent of the injury. Healing from a concussion requires rest, both physical and mental, to allow the brain to recover. People who suffer concussion must receive a doctor's clearance before resuming to sports, especially young people whose brains are more vulnerable. The next one is Achilles tendonitis. Achilles tendonitis is inflammation that causes pain on the lower back of the leg just above the heel. The area may become painful, swollen, and stiff. The pain worsens after physical activity. The tendon may become thickened, and in some cases, bone spurs may develop in area. Achilles tendonitis may be treated with rest, ice, stretching, and non-steroidal and anti-inflammatory drugs. Strengthening exercise prescribed by a physical therapist may help. Special footwear and orthotics can help take the strain off the affected heel. The next one is the runner's knee. Runner's knee, also known as patellofemoral pain syndrome, is a painful condition that occurs when tendons, joint lining or synovia, and or other soft tissues of the knee become irritated. Overuse can cause runner's knee, so can misaligned kneecap. In addition to pain, runner's knee may lead to popping and cracking. Switching to activities that do not stress knee joints may minimize problems. RICE, rest, ice, compression, and elevation may help. Non-steroidal anti-inflammatory drugs, physical therapy, and orthotics may provide relief. Rarely, surgery may be an option for severe cases that have not responded to other treatments. The last one is the sports injury prevention. Physical activity is an important part of maintaining overall health. However, certain precautions should be taken to minimize the risk of sports injuries. Using the correct equipment and maintaining equipment can help prevent sports injuries. Wearing the recommended protective gear can help shield the body against injury. Resting between workouts gives the body time to rest and repair. Starting activity slowly and gradually increasing strength, flexibility, and endurance gives muscles, bones, and other tissues the opportunity to adapt to more difficult workouts, minimizing the risk of injury. Finally, listening to the body and backing off at the first sight of pain, discomfort, stress, and overheating will help reduce the risk of sports injuries. So let's move on to sports injury rehabilitation. So first, what is sports injury rehabilitation? Sports rehabilitators help people to maintain and improve their health and fitness, recover from and prevent injury, and reduce pain using exercise, movement, and therapy, freeing you from pain and keeping you injury-free. From the word itself, rehabilitate, it is defined as to restore or to bring back into good condition. So sa sports rehabilitation, dito dinadala ang mga injured athlete at dito din tinicheck kung okay ba ang athlete palaruin or hindi. So the first type under sports injury rehabilitation is the rehabilitation plan. The rehabilitation plan must take into account the fact that the objective of the patient, the athlete, is to return to the same activity and environment in which the injury occurred. Functional capacity after rehabilitation should be the same, if not better, than before injury. The ultimate goal of the rehabilitation process is to limit the extent of injury, reduce or reverse the impairment and functional loss, and prevent, correct, or eliminate altogether the disability. So, meron po tayong rehabilitation plan upang mabawasan po ang ating injury at maiwasan, at also upang i-check po ang ating mga athlete. The next one is the multidisciplinary approach. The rehabilitation of the injured athlete is managed by multidisciplinary team with a physician functioning as a leader and coordinator of care. The rehabilitation team works closely with the athlete and the coach to establish the rehabilitation goals, to discuss the progress resulting from the various intervention, and to establish the time frame for the return of the athlete to training and competition. So, meron po tayong multidisciplinary approach upang may mag-manage sa ating injured athlete, and also para may mag-inform sa kanya kung kailan siya papasok ulit sa training or sa competition. Also, communication ay isa sa pinaka-importante sa ating rehabilitation, kasi kung wala pong communication at hindi alam ng ating athlete kung kailan siya papasok sa isang training or competition, maaaring pagpasok niya is hindi pa siya magaling at madadagdagan ang kanyang injury. So the next one, we have principle. Principle are the foundation upon which rehabilitation is based. Here are 7 principles, also known as ATC, ISIT. A, for avoid aggravation. It is important to not aggravate the injury during the rehabilitation process. Therapeutic exercise is administered incorrectly or without good judgment, has the potential to exacerbate the injury. Avoid aggravation, so hindi po natin kailangang pilitin ang ating sarili na maglaro kung tayo ay mag-injury upang hindi na po lumala. The next one is the timing. The therapeutic exercise portion of the rehabilitation program should begin as soon as possible. That is, as soon as it can occur without causing aggravation. The sooner patient can begin the exercise portion of the rehabilitation program, the sooner they can return to full activity. Okay, timing. As soon as possible, kailangan po natin dalhin sa rehabilitation ang ating injured patient upang siya po ay gumaling kaagad at makabalik sa paglalaro, dahil kung ito po ay ipagpapaliban po natin, maaaring lumala ang kanyang injury. Next one is compliance. Without a compliant patient, the rehabilitation program will not be successful. Thus, goals working as a motivation factor increase the effort to reach the goal and thereby increase focus, endurance, and direction for the athlete to continue, which is an important part of rehabilitation after an injury. Sa pagsunod ng ating athlete sa ating rehabilitator, mas mapapadali ang kanyang paggaling at ang kanyang pagbalik sa laro. I stands for individualization. Each person responds differently to an injury and to subsequent rehabilitation program. Even though an injury may seem the same in type and severity as another, undetectable differences can change an individual's response to it. S stands for specific sequencing. A therapeutic exercise program should follow a specific sequence of events. This specific sequence is determined by the body's physiological healing process. I stands for intensity. The intensity level of therapeutic exercise program must challenge the patient in the injured area, but at the same time must not cause aggravation. The last one, T stands for total patient. Treating the whole patient, it is important for the unaffected areas of the body to stay fine-tuned. This means keeping the cardiovascular system at a pre-injury level and maintaining range of motion, strength, coordination, and muscle endurance of the uninjured limbs and joints. The whole body must be focus of the rehabilitation program, not just in the injured area. The next one is the components. Regardless of the specific of the injury, however, here are the fundamental components that need to be included in all successful rehabilitation program. First is pain management. Medications are a mainstay of treatment in the injured athlete, both of their pain relief and healing properties. It is recommended that they need to be used judiciously with a distinct regard for the risk and side effect as well as the potential benefit, which include pain relief and early return to play. The next one is the functional rehabilitation. All rehabilitation programs must take into account and reproduce the activities and movements required when an athlete returns to field post-injury. The goal of function-based rehabilitation programs in the return of the athlete is optimum athletic function. So this is the stages of rehabilitation. The next one is the initial stage of rehabilitation. This phase lasts approximately 4 to 6 days. The body's first response to an injury is inflammation. Its main function is to defend the body against harmful substances, dispose of dead or dying tissues, and to promote the renewal of normal tissues. The goals during the initial phase of the rehabilitation process include limitation of tissues damage, pain relief, control of the inflammatory response to injury, and protection of the affected anatomical area. The next one is the intermediate stage of rehabilitation. This phase lasts from 5 to 8 to 10 weeks after the inflammatory phase. The body begins to repair the damaged tissues with similar tissue, but the resilience of the new tissue is low. Repair of the weakened injury site can take up to 8 weeks if the proper amount of restorative stress is applied, or no longer if too much or too little stress is applied. The next one is the advanced stage of rehabilitation. This phase begins at around 21 days and can continue for 6 to 12 months. The outcome of the previous phase is the replacement of damaged tissues with collagen fibers. After those fibers are laid down, the body can begin to remodel and strengthen the new tissue, allowing the athlete to gradually return to full activity. The next one is functional training. The combination of clinic-based and sport-specific functional techniques will provide an individualized sport-specific rehabilitation protocol for the athlete. Rehabilitation and conditioning exercises must be functional to facilitate a return to competition. Examples of functional training include joint angle-specific strengthening, velocity-specific muscle activity, closed kinetic chain exercise, and exercise designed to further enhance neuromuscular control. The next one is the return to sports. At some point in the recovery process, athletes return to strengthen and conditioning programs and resume sport-specific activities in preparation for return to play. The transition is important for several reasons. First, although the athlete may have recovered the medical term, movement in flexibility, range of motion, functional range, pain, neuromuscular control, inflammation, preparation for competition requires the restoration of strength, power, speed, agility, and endurance at levels exhibited in sport. The last one, monitoring. Monitoring athlete well-being is essential to guide training and to detect any progression towards negative health outcomes and associated poor performance. Objective performance, psychological, biochemical, and subjective measures, which is mood disturbance, perceived stress and recovery, and symptoms of stress are all options of athlete monitoring. Appropriate load monitoring can aid in finding whether an athlete is adapting to a training program and minimizing the risk of developing non-functional overaching, illness, and or injury.
Muscular muscles is composed of different muscles in our body. There are 3 types of muscle tissues. We have the skeletal muscle, cardiac muscle, and smooth muscle. Under skeletal muscles, we have temporalis, masseter, sternocleidomastoid, pectoralis major, bicep brachii, abdominal muscles, sartorius, quadricep femoris, and gastrocnemius. Under cardiac muscle, we have our heart, and under smooth muscle, We have the muscle of the intestines and other external organs and blood vessels. Muscular muscle also has its major function, which is the movement of the body, maintenance of the posture, respiration, production of body heat, communication, restriction of organs and vessels, contraction of heart. Muscle tissues has four major functional characteristics. First is the contractility. Contractility is the ability of the muscle to shorten forcefully or contract. Next is excitability. Excitability is the capacity of the muscle to respond to a stimulus. Next is the extensibility. Extensibility means that the muscle can be stretched beyond its normal resting length and still able to contract. Not the least is the elasticity. Elasticity is the ability of the muscle to recoil to its original resting length after it has been stretched.
Good day, everyone. My name is Danielle Atipawan. Now, I will discuss to you the function of muscular system and skeletal muscles. Without further ado, let's start. How muscular system works. Producing movements is a common function of all muscle types, but skeletal muscle plays three important roles in the body. First function is producing movement. It is the ability of the body as a whole reflects to activity of the skeletal muscles which are responsible for all locomotion. They enable us to respond quickly to changes in external environment. Second, maintaining posture. We are rarely aware of skeletal muscles maintain body posture, yet they function almost continuously, making one tiny adjustment after another so that we can maintain an erect or seated position despite the never-ending downward pull of the gravity. Third, stabilizing joints. As the skeletal muscle pull on bones to cause movements, they also stabilize the joints of the skeleton. Muscle tendons are extremely important in reinforcing and stabilizing joints that have poorly fitting articulating surfaces. Fourth, generating heat. Generating heat is the fourth function of the muscle. Generation of body heat is byproduct of muscle activity or what we call the ATP. Did you remember our ATP? ATP is used to power muscle contraction nearly 3/4 of its energy escape as heat, and this heat is vital in maintaining normal body temperature. The anatomy of muscular system. We have here the three types of muscles. First is the skeletal muscle. Skeletal muscle controls the voluntary muscle movements of the body. Also, skeletal muscle has a striated appearance. Skeletal muscle gets its name because it attaches to the bone or skeleton via tendons and ligaments. The location of skeletal muscle is right beneath the skin. This is the muscle that develops with exercising and lifting weights. Skeletal muscles control external movement such as running, walking, and lifting. These muscles can be controlled to exert a large amount of force or a very small amount of force. Next is smooth muscle. Smooth muscle is voluntarily and not under conscious control. Unlike skeletal muscle, smooth muscle is non-striated. The location of smooth muscle is in the organs of the body such as digestive system, the airways, and also blood vessels. This muscle is also known as visceral muscle because it is found in the organs. Visceral pertains to the organ or to the organs of the abdominal cavity. Smooth muscle controls peristalsis in the digestive system and the movement of the lung on inhalation and exhalation. Also, the smooth muscle controls the change in the diameter of blood vessels, or vasoconstriction and vasodilation. Finally, the cardiac muscle. Cardiac muscle is striated like the skeletal muscle and involuntary like the smooth muscle. This type of muscle is only in the heart. The location of cardiac muscle is in the walls of the heart. Cardiac muscle is responsible for the contraction of the heart. Contraction of the heart causes to move through the body. What are the 4 common muscle characteristics? First, we have contractility or contractility. This is the ability of the muscle to contract when the actin and myosin filaments slide across each other. A contraction is a reduction in the size of the muscle fibers. Next, a muscle must have extensibility. Extensibility is the ability of the muscle to stretch. Next is the elasticity. It is the ability of the muscle to return to its original position. Take note, once a muscle stretches, it needs the ability to return to its original shape. Lastly, we have excitability. This is the ability of the muscle to respond to stimuli. Muscles movement occurs in response to nerve impulse. Skeletal muscles. Skeletal muscles is commonly called muscles. These are organs of the vertebrate muscular system that are mostly attached by tendons to bones of the skeleton. The muscles are much longer than the other types of muscles tissue and are often known as muscle fibers. Skeletal muscles contain connective tissue, blood vessels, and nerves. Skeletal muscle is the only voluntary muscle tissue in the human body. It is controlled consciously. Every physical action that a person consciously performs. Examples are speaking, walking, or writing. It requires skeletal muscle. The function of skeletal muscle is to contract to move parts of the body closer to the bone that the muscle is attached to. Most skeletal muscles are attached to 2 bones across a joint, so the muscle serves to move parts of those bones closer to each other. Skeletal muscle cells form when many smaller progenitor cells lump themselves together to form long, straight, multinucleated fibers, striated just like the cardiac muscle. These skeletal muscle fibers are very strong. Skeletal muscles derives its name from the fact that these muscles always connect to the skeleton in at least one place. There are 3 layers of connective tissue: epimysium, perimysium, and endomysium. First is the epimysium. It is the dense connective tissue that surrounds the entire muscle tissue. The epimysium usually contains many bundles or fascicles of muscle fibers. Second, the perimysium is the connective tissue that surrounds each bundle of muscle fibers. perimysium. It is the connective tissue surrounding muscle bundles, and endomysium is the connective tissue surrounding the muscle fibers. Both types of connective tissue provide structural support to muscles. Collagen cross-links within the connective tissue matrix, and the type of cross-linking impact meat tenderness. Last, the endomysium. It means the muscle. It is a wispy layer of areolar connective tissue that heats each individual muscle fiber or muscle cell. It also contains capillaries and nerves. It overlies the muscle fiber cell membrane, the sarcolemma. So that ends my discussion. Thanks for listening.